here present at this time. We have, for the council members, we have Phil, Elizabeth, Sharan, Scott, Randall, Brandon, Jennifer, and then myself, Dominic. And as other people join in, we'll go ahead and add them in. At this point, I'd like to ask, since last meeting, we didn't have any items to vote on. And so the minutes were really just about updates for various programs going on. So I'd like us to just go ahead and accept those if possible, unless there are any concerns, and just move forward if that's all right. And of course, I'll take, if there are any no's, I'll go ahead and accept those. If not, we'll just move forward. Okay. All right. And our council membership has not changed since we have last met. So for that item, we will just continue moving forward as well. So at this point, it's about any subcommittee updates. And Phil, I've got you down first on the emerging trends. What updates do you have and any recommendations made?
No recommendations today. It occurred to me as we were setting up that I actually haven't heard anything at all about legislation and things that are potentially related to either the work that we're doing with drug checking or harm reduction or any of that realm right now. So I'm hoping we might get to learn some things today. Other than that, I mean, the drug checking program under emerging trends has been actually a pretty exciting place to be this year. Including a notable decrease in overdose death that is happening all over the United States, but some pretty significant numbers in New Mexico, and that has coincided with the recent health alert that we issued beginning in July. Our two pilot sites began detecting a decrease in the amount of fentanyl and stuff in things being sold as fentanyl, and include identifying some pretty unusual adulterants. One of them that's been appearing all over the country, we nicknamed BTMPS based on the contents of it. It's a chemical that is used as an additive to plastics to give it added UV light protection. And no one is really sure quite why that versus anything else, but it's been showing up either as part of like a whole bunch of other substances all at once in samples, or in some cases just by itself, and with no opioids or psychoactive substances at all, but being sold as fentanyl or pressed into counterfeit pills. And in a few places around the country, also an insecticide, acetamiprid, being sold as fentanyl. I won't go into all the details of that. We did issue a health alert based on that. We've had a lot of lidocaine. Lidocaine is showing up very frequently as another adulterant, and lidocaine is one of the substances that has cross-reactivity to xylazine test strips, and so a lot of people have been thinking that they've been developing wounds and stuff, which is consistent with IV administration of lidocaine. But of course, the confusion added by the test strips with folks, but most of the lab confirmed samples and things that we've had, it's been lidocaine as opposed to xylazine. And then all of a sudden, in the past 2 weeks, we've got heroin showing back up again. It's some of them, some of the samples in the past 2 weeks appear to be just heroin and heroin related compounds. But we have also had a few samples of heroin that had all of the other stuff in it. So, generally speaking, most of the samples sold as fentanyl look like very complicated, messy mixtures of 4 to 7 or 8 major ingredients and a bunch of trace amount substances as well. Fortunately, with the sort of left field chemicals, there's not sort of acute crises that they bring on for people, and so the health alert has focused on overdose prevention and naloxone because there still is fentanyl and real drugs in the mix, and being able to refer people into MOUD treatment. So that's kind of where that stands. We do have 2 new programs joining us to do drug checking in November. One will be down here in Las Cruces, running with the folks at the public health office and the harm reduction team, disease prevention team, and Alianza in Roswell. And we began work this 2 weeks ago on a it's going to be a publicly accessible data dashboard for all of the things that are being generated by this program, updated in real time and with some downloadable reports options built into there, so people will be able to look at stuff that's going on specifically in their region and download some reports from that if that is useful for their work.
Great. Thank you, Phil. And by the way, some really great news stories came out that mentioned both you and Dave Daniels, who, just for those who don't know Dave yet, Dave Daniels is actually, what exactly is your new title, Dave? Because I know they were talking about changing the title a little bit.
Hey, thanks, Tom. I am the new harm reduction section manager. So I guess it was Josh Swatek's old position, but it's been redone.
So it's moved around. So both Dave and Phil, you're both quoted quite a bit in various news stories that actually have gotten to quite a few national outlets, including like CNN and MSNBC and a few others. When I do that, when I do the searches for it, talking about the reduction in overdose deaths and mortality. And Phil, you're, just because if you haven't seen it, it's I love your quote, Phil. It's so the methamphetamine is just methamphetamine, and most of the cocaine or crack we've checked has just been cocaine or crack. So it's been some good news and good reporting out there to get information on out. So if anybody hasn't seen it, if you just do a quick search for overdose deaths in New Mexico 2023, they pretty much pop up throughout through there. So, but they're all based on the same interview or story that you all had done some interviews on, and they're all just showing up on that. So great job. And David, welcome to the team. So.
Yeah, I'd like to also point out that, all over the country right now, things have not been going great for harm reduction work in general. There's been well-funded organizations that have been going after programs and initiatives in places like San Francisco and others that are undoing a lot of the work that people have spent decades doing. So it's very refreshing that in New Mexico we actually took a program that when I was asked to step in and run it 20 something years ago was run out of a closet, to being what it is today, where the Department of Health has created a whole section of it or NM Health has, to be within what used to be the Infectious Disease Bureau and put all the related programming under it. So it's really some refreshing news in the national landscape that hasn't been looking too great.
Yeah. No, and that's a really great aspect to remember, Phil. We've been very lucky here in New Mexico to be able to have such support, and really the program growing from when you first started to now with David, taking the reins at this point, and it has continued to grow and expand and be able to provide better services throughout the years. And that's something that each person who moves into the role brings a new flavor, so to speak, to it, and also new programs. And so David, just to let you know, we're not watching you, but we're watching you. We want to see what great things you do, and I think it'll be really good. So, yeah. But thank you, and we're now. And actually, we've been joined by Josh, who actually was in the position previously. So, we have really good representation throughout the state for harm reduction, and I think this is really good. And a lot of people had their start with it. Brandon, for example, used to do HIV and harm reduction work. Starting here at the UH, and many others have been involved in it over the years. And so really great group of training and really great programs. And we have been very lucky in many ways over the years, and also helped to spread that luck. For us, it's always been about how do we help others do this same kind of work. So we export a lot of our programs to other places, as well as import. We definitely want to learn from others as well. But we have had over the years, a lot of opportunities to be able to help other states and other programs. So it's really great to see that progress continue. So, all right, Phil, do you have anything else with regard to the emerging trends?
Nope, I think just repeat what I started off with, since more folks have joined. If anyone has any updates and stuff about things that the Department of Health is interested in heading to the next legislative session, that would be helpful. And then if there's something that we need to get some on the side meetings happening for this particular subcommittee so that we can support those initiatives, that would be great.
Okay. Thank you, Phil. All right. And then our next subcommittee is the buprenorphine access. Chloe, have you all been able to meet?
So we haven't met in the interim. I apologize for that. But I have been working on this study that's been going on in the on availability of buprenorphine inventory across the state. And so we're getting to the point we should have finalized data ready to go and an analysis ready on November 1st. So that's where things are at with that. Other than that, no updates, but yeah, I should convene something soon so we can talk about those things. Oh, Philip, sorry.
Yeah, sounds great, Chloe. And Phil, before I jump back to you, just to give you an update, Chloe also, and Josh may have a little more information, but I think I have all the same information he does, is we are actually looking with the governor's office as far as that access and potential steps. So that report is actually going to be very key to being able to help determine what can actually be done from a Department of Health standpoint. So, and go ahead, Phil.
Oh, yep. I was just going to add that, yeah, we didn't have the finalized version of the recommendation the last time that we met, but that uh, after getting circulated and no one had any objections, that did get sent forward. Also, I believe that the Behavioral Health Planning Council had approved a similar recommendation, and the NMSAM group of ASAM have been working on something similar to locally for the sign-on letter that the ASAM folks and the pharmacy people and all that did. So, and uh, Senator Heinrich and another senator got their bill submitted that basically says the same things to go in there and like get that removed from the get buprenorphine removed from suspicious ordering. So.
And that's called the BUP Act, by the way, if anybody wants to look it on up. Yep. Oh, there. Oh, you already put it in the chat, Chloe. That's great. Okay. Any other updates on that? No. Okay, then we will go to the third subgroup, which is integrative pain management. And then I know Michael had joined in briefly. I'm not sure if he's still here, but Michael had let me know that Dr. Brandon Taylor was going to present because Michael's actually at a conference, and so lots of background noise was part of his concern. So Brandon, I'll turn it on over to you.
Okay, here I am. I'm on a lot of web pages. Hi, everyone. So my name is it's been a while since I've been on a meeting. It's been very busy. My name is Brandon Taylor. I'm a doctor of oriental medicine. As Dominic mentioned before, I used to be a harm reduction interventionist for the state of New Mexico in the early 2000s, and used to drive the syringe exchange van. My background includes work in inpatient and outpatient and harm reduction treatment programs. So I'm here today. I'm the chair of the New Mexico Acupuncture Licensing Board, and one of the topics that has come up, which I've discussed in past meetings, has been the fact that acupuncture currently remains the only essential health benefit as defined in New Mexico under the ACA that's not covered under Medicaid. So when people are trying to access integrative pain management, one of the most effective proven through research methods of dealing with acute and chronic pain is not available to them. Acupuncture actually and oriental medicine can save the Medicaid system a lot of money because it can prevent unnecessary surgeries or surgeries that could be avoided with less invasive methods, and that can save a great deal of money. Can also save money from people not needing urgent care and emergency care visits. What's happening in the last year, as I mentioned in the last time that I participated in a meeting, is the HSD, formerly HSD, which is now the Healthcare Authority, officially recommended that acupuncture be included in the Medicaid program, be funded. Doctors of Oriental Medicine have always been included in the state law for Medicaid, but it's just never been funded to cover acupuncture. HSD on its own approached DOMs and said, we need DOMs in the system because we have such a massive lack of primary care physicians and such a long-term wait for OTs and PTs if you're receiving the need for outpatient care versus transitioning to a SNF or through a hospital route. If you have outpatient, non-acute, non-emergent need, then getting into an OT or PT can take many months for people in the Medicaid program in New Mexico. And many people have very little to no access to primary care providers, which also cost the system a great deal of money and costs a great deal of suffering and leaves people with fewer treatment options. Acupuncture has been proven to help reduce the prescription need for opiate pain medications and prevent since 80% of people who have a substance abuse dependency on an opiate first receive their first experience from an opiate from a doctor's prescription, it's very important to try to prevent the need for that as much as possible. And obviously, if people are in extreme pain and have no other access to pain relief, then obviously something like an opiate or narcotic is a logical thing for some people. In some cases, of course, acupuncture providers are not trying to suggest otherwise. So in 2022, there was a major review of research that was done by this committee. And I'm going to just summarize it as briefly as I can for everyone. I have it open over here. The committee voted unanimously. I believe it was unanimous. If you have another memory, Dominic, please let me know. I don't know if anyone abstained or not.
It was.
Okay, thank you. On September 9th, 2022, this advisory council made an official recommendation to the governor's office to provide equal access to non-pharmacologic pain management for Medicaid recipients for acupuncture. The rationale was that effective treatment of pain without opioids reduces burden of addiction and overdose deaths. DOMs have a broad scope of practice, treat pain and much more. Acupuncture is defined as an EHB, an essential health benefit under the ACA, but is not covered by Medicaid in New Mexico. And also every other essential health benefit, including chiropractic, is now covered in some form by Medicaid. Acupuncture is the only EHB that is not covered to date. There's been a lot of movement toward coverage of acupuncture. Medicare covers acupuncture for chronic low back pain in a limited way. The VA offers acupuncture to veterans and hires acupuncturists. 16 states include acupuncture in their Medicaid benefits. That would be, what is that, about more than 30% of states now cover acupuncture in their Medicaid program. So we would not certainly be alone in doing so. In New Mexico, Presbyterian has some coverage of acupuncture for dual eligible Medicare Medicaid members, but again, that's also very limited. Despite these programs, most New Mexico Medicaid beneficiaries have no access to acupuncture coverage, and that's about 800 to 900,000 New Mexicans, roughly, depending on what month we're looking at and what percentage are enrolled at that time. So that is it's about 40% of New Mexicans that have no coverage of acupuncture can get all of their other medical services covered at zero cost to them, whether that service is $100 or $1 million of care in a NICU, et cetera. It's covered at 100%, but they have to pay 100% for acupuncture, the only EHB they have to pay for. The data supporting the recommendation showed that evidence-based acupuncture proves effectiveness of acupuncture for pain and other conditions. There's a number of biochemicals involved that regulate pain that are balanced by acupuncture, including ATP and adenosine, GABA, and substance P. Various NIH publications have recommended the use of acupuncture for pain. Let's see, what else? The final things are that in New Mexico, doctors of Oriental medicine are primary care providers, licensed to diagnose, treat, and prescribe for any disease, illness, injury, pain, or other physical or mental condition. I'm going to just segue from that from every other, service, workers' comp, auto, med pay, all health plans, whether they're nonprofit or for-profit health plans, must cover DOMs and their care without discrimination. It goes on and on. So thanks to this committee for voting unanimously 2 years ago on this matter. I believe that is part of why HSD was moved to make that recommendation, together with, of course, the severe lack of access to primary care. I want to make clear that DOMs are not using hubris or being arrogant in general and thinking that we can substitute the need for an allopathic primary care provider. DOMs are trained as primary care physicians when to refer and who to refer to. And we're trained to encourage our patients to have an allopathic primary care provider and to utilize regular normative, blood work and imaging and preventative services like mammography and on, so that people understand a whole perspective of preventative care and primary care. I just wanted to say that there's also a bill that's been it's been attempted for years at the federal level. You won't be surprised. All it takes is an act of Congress to include it in Medicare, LOL. The Acupuncture for Our Seniors Act of 2023 from Representative Judy Chu, and Brian Fitzpatrick out of California and Pennsylvania would increase access to acupuncture in our healthcare system by ensuring that licensed acupuncturists can participate as providers in Medicare so that seniors have this effective treatment option available to them. In a nutshell, presently, there's a limited cover of acupuncture for low back pain in Medicare, as mentioned earlier. However, it's only when provided by a Medicare participating provider, and acupuncturists and DOMs are not in the law and have never been added into the law of Medicare at the federal level. Therefore, they can receive acupuncture. Medicare patients with low back pain can receive a limited number of annual acupuncture visits from a nurse practitioner, a PA, or an MD. There are NPs, PAs, and MDs that practice acupuncture, but it's quite rare and probably less than 1% or a few percent of total of those allopathic modern medicine providers actually are trained in and provide those services. So it's kind of like having a benefit that is almost a non-benefit until acupuncturists are included in the federal program. However, acupuncturists and DOMs don't have to be included in the Medicare federal program to be able to provide the care, as the other 16 states have evidenced. What happens is all that is needed is a budget. HSD themselves proposed a budget of only $7 million, they believe, because we live in a state where 80% of the Medicaid budget comes from federal dollars and only 20% comes from state dollars, because we have such a high percentage enrollment of Medicaid, has such a high percentage of poverty and near poverty level financial predicaments for our fellow New Mexicans. We only have to contribute as a state 20 cents on every dollar that is spent. They believed that $28 million would cover for all Medicaid participants on their own analysis that they have published and provided to the governor's office and the legislature. And that would mean that basically for about $3 per New Mexican, what would that be? Pennies a day? For literally pennies a day. Thank you. Call now. Operators are standing by. I'm sorry. For literally pennies a day per New Mexican total, we could cover literally all New Mexico Medicaid enrollees with the same amount of acupuncture option, which some would opt into and some would not, available to them per year, up to 20 visits a year, about one visit every other week up to. And it also said in the essential health, in the ACA plan benchmark in New Mexico, that 20 is the minimum requirement, and that if anyone has a major rehabilitative need or a major injury, et cetera, that it's expected that plans would offer more for those individuals as reasonable. Any questions or feedback? I'm sorry I'm talking so fast. I just don't want to take up too much of everyone's time, because I know that there are a lot of other life and death issues going on regards to harm reduction and overdose prevention as well.
And if anybody hadn't seen it, I put the link to that recommendation from 22 in the chat so that you can actually read through it and see that.
So I'm asking that we have another vote on this matter because I think it would be helpful to be clear of where the council stands for the powers that be, the new healthcare authority. There's always, the HSD was last year, right? Now that organization doesn't even exist, of course, I'm sure many of the people who worked at HSD work with HCA, would imagine. But we know that the former director, or acting director, Lorelei Kellogg, of HSD, as far as I know, no longer works for the state of New Mexico and is no longer involved at HCA. And she was spearheading with a group of employees there, their own proposal. So I think it would be helpful for those who are new to the HCA, for the governor's office. I'm sure they have a lot of things on their plate. For the legislators, I'm sure they have constant information coming into them to help them understand the rationale. So what I'm proposing is utilizing the same data. It's from literally 2 years ago, and the same proposal, unless there's any edits recommended or any controversy or other thoughts or data or concerns. I'm proposing to have a vote on this matter to go back to hopefully be conveyed to the governor in whatever way the council conveys their recommendations to the governor. That part's always a little gray area for me, but sorry, there's a lot going on. It's hard to remember all these things. So are there any other thoughts about this? I feel awkward. I don't know how to propose this officially.
Nope. You're doing just fine, Brandon. And just so everybody knows, is what essentially happens when this council actually has a recommendation and votes on it. And if it's a vote in the affirmative, what then occurs is we turn that actually over to the Department of Health Policy and Communications Director, who often attends this meeting, Aria Lamb, and then she conveys it on over to the governor's office after that. Quite often when there are items like that, the department itself will do some additional research and review, either to provide their recommendation also to the department. or I'm sorry, to the governor's office. So that quite often happens. Or the governor's office will ask after the fact, after the recommendation has been sent, and ask, are there other information and is there other discussions that need to occur? And they'll oftentimes convene meetings or look into it further. So that's pretty much what happens with the recommendations that come from here. And just to reiterate what Brandon is asking is, and correct me if I'm wrong, Brandon, but just if there can be a confirmation vote essentially to reiterate the recommendation that was made back in 2022, and as Michael said, back in 2013 as well, but to reiterate and to send that once again to the governor's office for consideration. Is that correct, Brandon? Did I get that?
I literally couldn't have said it better myself.
All right, well, thank you. So before we do that, is there anybody who has any questions or concerns with regard to the recommendation? Okay, are there any objections to the recommendation and to us sending that forward again? All right, seeing none, I'll consider that to be unanimous, and we will go ahead and forward that into the process. So thank you, everyone. And thank you, Brandon. And thank you especially for bringing this on up again. It's an important issue, and so it is something that I think we need to keep on the forefront.
Thank you very much, everyone. May I also read something that Michael Pridham asked me to share?
Oh, absolutely. Go ahead.
Thank you.
And then once you do that, then we'll go to Phil.
Excellent. So Michael is attending a conference in Denver that's focused on using integrative therapies for treating addiction, depression, and trauma. And we know that those all, of course, tend to go together for many published reasons, and as ones that are pretty clear to all of us. He thanks me for speaking on behalf of the committee. The Healthcare Authority has been working with the chiropractic medicine community for the rollout of Turquoise Care Program benefits, aka Medicaid. Medicaid will now cover examinations and spinal manipulation for patients with neck pain, back pain, and headaches. Initially, there was a pre-authorization requirement for those Medicaid enrollees to receive the chiropractic services. However, that has thankfully been removed, and which is a very positive step forward, especially given that people can access all other kinds of services without any kind of prior authorization under Medicaid as well. Many different services, not necessarily all. There are arbitrary limits within Medicare that have been in place nationally, that have been in place for 50 years for chiropractic medicine. HR 1610, the Medicare Chiropractic Coverage Modernization Act, has gathered 177 co-sponsors in the House, and 14 senators have signed on to the companion bill. He thanks Senator Martin Heinrich, Ben Lujan, Representative Teresa Leger Fernandez, Representative Melanie Stansberg, and Representative Gabe Vasquez for co-sponsoring. Once this bill passes the national level, it would improve the amount of modalities that patients will have access to within Medicaid in New Mexico. He thanks everyone for continued support of integrative medicine and access to care. I will add as a healthcare equity and parity issue, given the fact that all of the benchmark plans, ACA requires this for every other person practically receiving healthcare in New Mexico. Any questions? If there are any, I'll do my best on that. And then the last thing I wanted to say is that there is, one of those online petitions for the coverage of acupuncture under New Mexico Medicaid. I'm just going to put it in the chat if people want to click on it and sign their names. That's obviously totally up to you whether you choose to do so or not. Thank you, everyone. Really appreciate your time and all your work on these really important issues that you are all addressing, which are pretty phenomenal. So thanks for your work.
Thank you, Brandon. And Phil?
I just wanted to, say I think this is really awesome, and I'm really glad that you all have not keep approaching the issue and pushing it. I think it's really important. I had no idea. I learned how difficult these things were when we were working on the original AccuDetox legislation way back, and and all the just everything that goes into it. So thank you for continuing to bring that forward. Have you had a chance to talk to or present to the Behavioral Health Planning Council folks?
I believe that is something. I'm going to take a note of that. So I'm the chair of the licensing board, but there's also a professional association, at least one or more in New Mexico of acupuncture providers. My understanding from speaking with someone who is on that board is that part of the issue is, I guess, all of these legislators have a bunch of things that come in front of them, and they had a lobbyist who was also working on this and other issues, and that lobbying group had 3 people, and at the beginning of the last legislative session that was this past January, one of those 3 lobbyists passed away actually within the first days of the session. And that was apparently the expert on these matters, the one who worked on these matters the most. My understanding is that they've hired a new lobbyist and that they're working with them on that issue. So what did you say, the behavioral health, what was it again?
Planning Council. And I know that there's been a lot of personnel changes and things that have as it's gone from HSD to HCA now, and but that's a group of people that works with them, and it's a good way of tracking, trying to keep track of what's going on in there instead of all the secondhand kind of stuff that most of us get from being peripherally connected to that.
Yeah,
So
I feel very peripherally connected to it, to say the least. So New Mexico Behavioral Health Collaborative, is that what it is? The Behavioral Health Collaborative, or is that something else as well?
no, that's
excellent. I really appreciate that. I will, I hope that they will do that, and I will mention it whenever I see anyone involved in that again. And thanks for bringing that up. Hopefully there'll be people that understand, since also, of course, DOMs are licensed to treat any mental health, emotional condition as well. That is something that should obviously be going there as well. So thank you so much for mentioning that.
Okay. Any other discussion or comments on this? All right, so our next item of the agenda is other business. Are there other items individuals would like to bring up, or additional announcements, goings on? Now, I think this is going to be one of our shortest meetings. Everybody must really be looking forward to the 3-day weekend today. So, okay, I'll just ask one more time. Any other items or announcements or other pieces of business people would like to bring up?
Dominique,
Okay.
this is Jennifer. I don't know if you can hear me okay. I was just wondering, could you, I know he had just mentioned that there would be a link in the chat if you wanted to personally sign, and I just didn't see it.
Oh, Brandon, I don't think he's been able to put it up in there yet. I can see he's focusing on the screen. So I think he's probably doing that, Jennifer. It should show shortly.
Perfect, thank you.
So,
it's on change.org, and I'm going to post it now. And then if anyone else has a question about it, feel free to reach me as well.
Okay, great. Thank you, Brandon. Okay, and so our next item then is going to be setting up the meeting for our next meeting, rather, which will be in January. And I do have that for our usual date would be Friday, January 10th, starting at 1:30. Is there any objection or issue with regard to that? It's actually a good time to meet because it is just before legislative session. So if there are questions about legislative session or other items coming on up, we can talk about them during that time. One of the things we usually do in that particular meeting, either our last meeting of the calendar year or the very first, if we're doing one in January, is go over sort of what happens. So for example, talking about how we actually create recommendations, how they move forward, and what happens to them after we vote on them. But we'll also talk about what we can and cannot do with regard to the legislature. And we'll kind of go into a little bit of that information during that meeting. So we may have a guest to help explain some of that with regard to the legislature. And so I may put that onto the agenda. Other than that, are there any specific items individuals would like on the agenda?
Do we know if there are any specific opioid related or pain related things coming up in that legislative session?
Not yet, Leslie. It's a great question, but we do
Okay.
not know. As we hear about different items, we'll of course try to disseminate them as much as possible. And thank you for bringing that up. We usually do have a section in that January meeting where we talk about whatever has come to the front so far.
I have heard rumors, which I hope are false, that they're thinking of making fentanyl use during pregnancy count as child abuse for child welfare. And if that's the case, I would really like us to take a stand on that one. So,
Okay, thank you. I had not heard about that. But yeah. All right, we'll definitely keep a lookout for it.
thank you.
And if you see anything, let us know.
Okay, will do.
Yeah.
Hopefully it's gone away all on its own. Poof, and now we can worry about heroin again. That's what I heard the police say that on some thing that was running on the news a couple years ago, and be interesting to hear what they have to say about that today.
All right. Any other items? All right. Well, thank you, everybody. I hope you all have a great rest of your Friday and a great weekend. Remember, Monday is Indigenous Peoples Day, and so I hope that you all have appropriate celebrations to honor the Indigenous people, especially of New Mexico. And other than that, if you have questions about anything, please reach out, and we'll see you on January 10th. So thank you, everybody.
Thank you.
Have a
Thank
great
you
rest of
all.
the day.
Appreciate it. Bye. Bye.
Stay safe.